The H1N1 virus will soon be all around us, adding an additional cause for concern this flu season. But what groups are considered most at risk for complications from H1N1 virus? And who should be vaccinated?
The symptoms for H1N1 are almost exactly the same as seasonal flu. It's fevers, chills, muscle aches. So it's very difficult for a person to know, do they have H1N1, do they have seasonal flu, or do they have something else? And by that same token, it's difficult for clinicians and physicians to know the same thing. The people whom we are most concerned about are children that are under the age of 2, are people who have underlying risk factors, which include people with immune-compromised conditions like HIV, transplant patients. Also people with chronic conditions, kidney conditions, people who are on dialysis, people who have asthma, people who have heart disease. Those people will be at higher risk. We have a particular concern, and there has been a lot in the news about this, in protecting pregnant women because they seem to have a much higher risk if they get infected. Pregnant women will be one of the highest priority categories on the list when the vaccine is available. The best thing to do to avoid H1N1 is to avoid situations in which you might be in contact. Now, it's very difficult for people because we don't want to say that you shouldn't go to work and you shouldn't go out into the community, because it's really not recommended that people stay home and isolate themselves. But they certainly should avoid people who are sick. The way this disease is passed requires pretty close contact with somebody who's sick. And so, again, avoiding being within 3 to 6 feet of somebody who's sick, washing your hands, not touching one thing that people do is they touch something and then they touch their face, really avoiding that kind of behavior. The message we're trying to get out there from healthcare and public health: cover your cough, get vaccinated if you're in one of the high-risk groups, get your seasonal vaccine, and protect others around you if you get sick.